Okay, today I'm going to talk a little bit about schizophrenia, psychosis, or what can be called in lay terms madness, finding the meaning of madness. An interesting thing about madness or psychosis is that people who study it have been very uninterested in how it really feels. I'm a clinical psychologist and I've been practicing for 26 years, and still I haven't really read much about how it feels for people who have hallucinations, who have delusions, what it really feels like. Now, that's strange, that's crazy. Much of what I'm going to say today is based on psychologist John Reed and his colleague Jim Geeky, and what I've written on the topic in the book Meaning of Madness. And they found out that less than 1% of the research on schizophrenia has been on the experience of schizophrenia by the people who are the very experts, the people who have it. Now, saying that you have schizophrenia is kind of an oversimplification because people cannot really agree on what it is. Having hallucinations, having strange ideas is a lot more common than people think. So how can we really define this as sick? We become sick if it's so much that it prevents the person from taking part in normal life. But in many cases, the fears of a person who's anxious are just as strange as many of the psychotic ideas, so-called psychotic ideas that people can have. And then there comes the problem of what is reality. Some researchers in the field, they say that we have to talk about consensus reality, what most people agree is reality. An interesting thing is that medicine in itself has had a lot of strange ideas through the times. For instance, the idea that you can cure so-called schizophrenia by destroying brain tissue by putting an ice pick in through the eye socket and moving it around. One researcher, or many researchers, thought that this is the way to cure schizophrenia. They have too many brain cells, they have too much mental activity, we have to stop it in some kind of way. Okay, and the guy who invented it actually got the Nobel Prize for it, so the whole profession, we might say, was deluded. Other strange treatments have been to drown the patient. The Germans even constructed a cage where you could just roll the patient into the water while he was encased in a metal case, and then when the bubbles stopped coming up, then you knew that the patient was by all practical purposes drowned. They took him up again and resuscitated. After that, the patients were very calm. Insulin shock treatment, where you actually give patients brain damage through giving them very low blood sugar and cramps and all the things associated with it. After that, the patient is very calm. Electroshock, the same thing. We destroy brain tissue with electricity. We let them have convulsions that we actually think normally is very dangerous for the brain. And yeah, at least for a while afterwards, they can't think too clearly, so they're not so depressed. But this has been proven to work only for 4 weeks. And then the sham ECT, where you don't give the shock, is just as good. So it is a treatment that can be very bad for the person, but it has very little effect. So anyway, medicine has had its own delusions, we might say. Now the theory in medicine is that this is biological, that there is something wrong with your dopamine system in your brain, and that medicines that block the dopamine system will give you the cure. The problem with that is that a lot of people get real bad neurological problems with these medications, almost 100% will get so-called tardive dyskinesia, which consists of these strange mouth movements in many cases, but also it can be in any part of the body, including breathing, so that people will breathe like that for the rest of their lives. Very bad side effects. And in the studies of a psychologist called Martin Harrow, those who had stopped their medication, even if they were in the worst group, really bad schizophrenics, they did a lot better, 8 times better at 20 years follow-up. And his research is good because he actually did a very long follow-up. Those who had taken the medications dutifully through these 20 years had a lot more psychotic symptoms, and what was more important was that they were not doing that well socially. Okay, so how do people normally consider psychosis? What do the people themselves think are the reason for the psychosis? And if you interview patients, they have quite a multifactorial view of it, compared to the medical profession that thinks that this is bio, these are biological problems and we have to treat them with biological means, medication or electroshock. Patients are more, those who have it themselves say, it had a lot to do with my stressful life situation, had a lot to do with my relations, had a lot to do with the way I have been trained to think, the way that my thinking habits. Could also have something to do with biology, but then more in the sense that I didn't eat, I took drugs, I didn't take care of myself in any way. So patients actually have a quite biopsychosocial view of madness, whereas the profession now, especially medical profession, thinks it's largely biological. Actually, what the research has shown is that it's very easy to see a link to adverse life events when you are young. You know, people who have been sexually abused, neglected, or abused in any kind of other way have a lot more so-called psychotic symptoms. They hear voices, they might say bad things to them and things like that. So patients and the normal population actually thinks it's much more psychosocial. It's much more related to what has happened to you. Not what are you suffering from, but what happened to you. Not what's wrong with you, but what happened to you. And the interesting thing is that medical profession and some organizations of parents with children who have so-called psychosis or madness, they think that if we can just make everybody believe that it's a sickness like any other sickness, that it's biological, then the stigma will go away. Then people won't feel so bad about it because they can't help it. It's a sickness that they had. The problem is that research has shown that when you have these kind of explanations, then people want to have more distance. If they think that their neighbor is biologically sick, they will want to have distance to this neighbor. They don't want to be friends, they don't want him to be their daughter's boyfriend and things like that. So actually the biological view of madness creates more stigma. But the medical profession is so sure about their bio-only view. I don't say that biology doesn't play a part, but the problem is when you put a lot of weight on the bio and you think that there are not other things that contribute, then you're kind of stuck. What can you do biologically? Yep, only thing that you can do is to give medication. When patients hear that okay, they have to take medication, unless if they don't do it, their brain is going to deteriorate. Now we know that, of course, this is quite wrong. There's no sign that the brain will deteriorate without medication, but we have quite clear indications that you lose brain mass if you take the medication. Get enlarged ventricles. Animal studies have shown that only 1 year of treatment can kill 10% of the brains of monkeys, research animals. So anyway, it's the delusion that has been going on in the medical profession is that in a way you have to take these medications, if not your brain is going to be destroyed. When people get to hear that I have to take these medications that give me horrible side effects for the rest of my life, then of course they get very depressed and the risk of suicide is increased. So what do normal people think? Actually, the majority thinks that schizophrenia, psychosis, madness are caused a lot by psychosocial stressors. For instance, losing a job, losing a relationship, death of a family member, etc. The good thing, I would say, as a psychologist, is that when you say, okay, this is a reaction that anybody could have to very hard life events, that means there's basically nothing wrong with you. You had a strong reaction and we can use our psychological techniques to help you with that. Conditions can change. In a way, you have suffered a relationship breakup, but you can get another relationship, etc. So with the psychosocial explanations, there's a lot of hope. There is a lot of hope. You can learn to think in different ways. You've learned to think in different ways before. You learned very difficult thinking skills. For instance, you've learned to read. You've learned to walk when you were small. Some people have learned another language. So there's a lot of hope that the brain can change. We can reprogram the brain. But to think that we can do something with just chemicals is very, very simplistic. They might help in certain ways. They might calm down a person who's very, very distressed. But in the long run, medication often just contributes to avoidance. Okay, you're feeling so bad now. Okay, you have to avoid it with medication. Okay. What is that like? It's like if you're afraid of going to the shop, stop going to the shop. If you're afraid of going out of the house, oh, by all means, you mustn't feel anxious, so don't go out of the house. So in many cases, medication can function as an avoidance. And then it actually hinders learning instead of helping it. There's actually research that SSRI medication, because it is dampening, it is flattening, it decreases the learning in the amygdala, the important center in the brain, so that you learn less quickly when you are on SSRIs than when you are medication free. So in many treatments, like for OCD, it's an advantage if the person doesn't take medication, because then the exposure training works. So the point is that luckily normal people, they think that psychosis, madness is much more a result of what happened to you. And that's good. The only problem is that pharmaceutical companies will want you to think it's biological, so they promote that a lot, and they even call it mental health literacy. So, but rest assured, in a way, the psychological is proving more and more that we can fix this with psychological means and not just dampen it down with medication.